Hello dear patients, today we are going to discuss the case presented on the picture. This is quite a common case of penis folliculitis. What is folliculitis? Basically this is a pustule in the area of sebaceous hairy follicle. Hair on penis, even if they are small, have a sebaceous gland in their content, and altogether hair and sebaceous gland form hair-sebaceous follicle. If there is a sebum, then there are microorganisms who like to feed from it. They penetrate inside the hair follicle. These are propionibacteria acne, these are staphylococci, etc., and other bacteria. What to do if follicle appears? First of all, sexually transmitted infections have to be excluded. These can be herpes. Patients, and less so doctors, sometimes think that this is folliculitis. Here there is quite a simple way of differentiation. This is scraping PCR analysis for herpes of first and second type. Usually I also take analysis for herpes genitalis, as it can also be present on penis. Then these are culture tests to find out which bacteria are there and to which antibiotics it is sensitive. If these are singular folliculitis, if they appear relatively infrequently, then we can try to use, at least on the initial stage, ointments with antibiotics. Before the results of culture test come, erythromycin ointment was prescribed for this patient. It is used 1-2 times a day. Within 5 days, some causative agent should be found, and this ointment should be changed to some acting substance, or its use should be continued if erythromycin influences this particular causative agent, one bacteria. So analysis for herpes were taken from this patient. By the way, I forgot to mention that molluscum contagiosum is very similar to folliculitis in some cases. We have a separate video about molluscum contagiosum. You can see what it is. This is a different skin infection which is transmitted by a sexual way. So mainly these two infections have to be differentiated from folliculitis. For this patient, erythromycin ointment was prescribed first, then it was changed to tetracycline ointment. In this patient, folliculitis appears quite rarely, singularly, so external therapy was quite sufficient. If folliculitis is relapsing, then internal antibiotics are prescribed, and in some cases immunogram is taken. Immunity is checked. Usually, immunity is affected during frequent folliculitis, pustules of skin in the area of penis. However, for this patient, 2 ointments were prescribed, and as a result, folliculitis resolved. Remember that you shouldn't press folliculitis out on your own, as you can get infection deeper. This can be abscess, a large pustule of penis. You can watch a separate video on our channel about this topic. If it is necessary to diagnose and treat purulent and other lesions in the area of sexual organs, you can consult venereologists and dermatologists of our paid medical center of Dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.